100,000 vacancies in the NHS. It's attracting the best healthcare professionals from around the world. That is a priority, say all the parties, all the political parties, in the run-up to the general election.
The Conservatives have announced plans for an NHS visa, which it says will fast-track applicants and address concerns within the health service that it will struggle to attract the staff it needs after Brexit. So we're joined now by Conservative Priti Patel. Very good morning to you. Thank you for your time this morning. I just wonder if you could first of all outline what this NHS visa is.
Well, this will be a new fast-track visa for NHS workers from around the world that can come to the United Kingdom. And effectively, this will guarantee them, through this fast-track process, the chance to work in the NHS, be sponsored by the NHS. So this will be doctors, nurses and allied healthcare professionals. And they'll be able to come and work in any aspect of the NHS across the United Kingdom.
What will they have to do to qualify for this special visa?
Well, firstly, they'll need to be a qualified healthcare professional, so doctor, nurse, or a specific healthcare professional. And they will apply, as they would already, through the Home Office, through UKVI, for a visa which would be backed up through the NHS. So they'd be tied into work to the NHS. And effectively, they'd be guaranteed that place through their qualifications, through the new points-based immigration system that we'd be looking to introduce once, of course, we've got our Brexit deal through Parliament, with a new functioning Parliament, and they'll then be able to come and work for the NHS in any part of it, any part of the United Kingdom.
What will it cost?
Well, in terms of costs of a visa, we are going to look to reduce the cost, halve the cost from over £900 to around £400. But of course, this would be a sponsored route through the NHS. So this would be tied employment specifically for the NHS, because of course, doctors, nurses and healthcare professionals will be joining an aspect of the NHS in any part of the UK.
In principle, getting people to work for the NHS from outside of our borders post-Brexit, it will be harder than before. Is that true?
Well, actually, this would be a new route. So the point is we're creating this fast-track new route visa option for people from across the world. So this isn't just from the EU, but from outside of the EU. We want balanced immigration. We want to bring the best and the brightest to the United Kingdom. People that want to contribute, actually, both to our economy, but to our public services. So actually, I think this will, as we're already seeing, we have currently 6 times more people from the rest of the world than from the EU coming to work into our NHS. We want to streamline that process. We want to fast track that process. We want to make it simpler, more efficient and less costly for them to come and join our NHS, and make the great contribution that people do already from outside of the UK to work in our NHS and in our public services.
One of the very, very real issues this appears not to address is that the 100,000 jobs we've quoted is within the NHS directly, doctors, nurses and other qualified medical staff. There are other huge gaps in care more generally, in social care, for example. Now, will this project also be extended to those who work in social care, who will be qualified people who work in social care?
Well, we've been very clear, and as Home Secretary, I've already outlined as well that we want to introduce a points-based immigration system, an Australian-style points-based system. But to do that, obviously, we've got to get Brexit done. We've got to bring the legislation through into Parliament. And I've already commissioned the Migration Advisory Committee to actually look at this. And so we'll be making further decisions that will influence the workings of the points-based system once the MAC reports in January 2020, so that'll be early next year. And of course, they'll be providing the evidence base to bring that detail forward. And of course, that'll cover a range of sectors that'll then help to inform the points-based system.
Well, the thing here is that you're addressing, because it's a major concern to people, the NHS, specific to these visas. A lot of people will say that alongside that, and very much connected, is the issue of social care. So the logic would be to apply the same principles in connection with these special visas to the other part, if you like, of the health network, which is the social care element, which is also crying out for staff at the moment. Why not do it for both? If you think this system would work, why not address social care at the same time?
Well, first of all, I've been very clear that through an Australian points-based system, we want the skilled people coming to the United Kingdom. That is the right approach, and that's fair and that's balanced. And at the same time, that allows the government to be in control of its immigration policy in terms of the skills that people bring to our United Kingdom, to our country, and work across the whole of the country. Now, I have already commissioned the MAC, and the MAC are looking at certain sectors. And of course, when it comes to social care, that'll also be a sector that will be considered by the MAC. So we're not ruling any of that out. We're looking at that. We're going to look at this from an evidence-based perspective, and of course we want people that are going to contribute to our economy and to the skill shortages that we have in our labour market. That is the right approach, and these are the principles that we'll be applying going forward to the points-based system.
The reality of the situation within a hospital, of course, is there are doctors and nurses, of course, but there are an awful lot of other people who are absolutely essential to the smooth running and the effective running of a hospital. Could be a cook, could be a cleaner. Why are those groups of people not going to be included in this same category?
Well, I've already made it quite clear. This is a specific visa for the NHS. So this is a new fast-track route.
Sorry, I'm going to try and interrupt you if I may, and I know sometimes it's a little difficult because you're down the line, but specific to the NHS, if a hospital has a whole number of vacancies which are not medical staff, which is 12 cleaners, a porter, do those jobs fall within the category you're talking about, because these are jobs that are within the NHS?
So I've already been very clear that this NHS visa route is for skilled doctors and nurses and healthcare professionals. And when it comes to the other sectors that you're speaking about in terms of employment and vacancies within the NHS, it is quite clear that within our own labour market we can fill many of those posts and positions.
Well, we can't, can we? Because there's 100,000 jobs outstanding.
Well, we are speaking right now about skilled positions, doctors and nurses and healthcare professionals. And let's be very clear, we do need to do more to bring in and train at the same time more people to work in the NHS. And we're already seeing that, we're already doing that. We have new medical schools training people in the United Kingdom to work in our NHS. But at the same time, we've commissioned the MAC, the Migration Advisory Committee, to look at this in terms of the skills base that we need for our labour market. So this is just one part of that.
We have already. You have already said that. If I may,
that points-based system.
If I may, I don't want to try and go over things you've already said. Can I ask you a very, very straightforward question, which is, post-Brexit, under your plans, under Conservative plans, will there be more people from overseas working in the UK than there are now?
Well, I think the fact of the matter is we've been very clear that we want a balanced and fair approach to immigration. And that means we want a system where we have the best and the brightest with the skills that our country needs.
So it could be more. That's what you're saying. The answer you're giving me suggests that you think the answer you're giving me suggests that you think it could be more. The answer to that question, given what's this topic is of such consequence during the Brexit campaign itself, you seem to be saying to me this morning there could be more people from overseas working in the UK under Conservative plans.
Well, if you let me finish, under a points-based system, we would have controlled immigration. And that is the fundamental difference to the immigration system and the approach that we have right now. And I think it's fair to emphasise that during the referendum campaign, the Brexit referendum campaign, the public voted for immigration control. They want to know that they've got a government that will control immigration while at the same time have a balanced and fair approach around migration. People that come to our country will be contributing, unlike what we see with the Labour Party, which is unlimited and uncontrolled immigration. We want a system that is fair, we want a system that is balanced, but we want a system that the British government is in control of.
Thank you very much for your time this morning, Priti Patel, speaking to us from a slightly noisy high street there. Thank you for bearing with us.
Thank you.